medical school when I got when I was in med school, you know.
Yeah.
But those are the challenges in terms of contingencies.
Yeah, so
Mariam,
just
before
to
we go ahead, quick one.
Yeah.
Let me just acknowledge the fact that Sister Wasila sneaked into the studio while you were on with Dr. Bashira while she was talking. Our other host, one of our hosts, joined us. She did say she'll be late because Madam No Gree stop reading. She wants to continue reading. Haja Wasila, you're welcome. Assalamu alaikum.
Thank you. Assalamu alaikum.
Wa alaikum salam.
Wa alaikum assalam wa rahmatullahi. You're welcome, Haja Wasila. Okay, so we are just going on to our next question. First question Dr. Bashir was responding to when you came in were challenges she faced on the continents, on the 4 continents that she has practiced medicine on. She said people say 3. I said she has to correct them. That it makes me very angry for them to shortchange us like that. So she explained to us that PLAB is the exam that you sit when you want to get into the UK system, whereas USMLE is where you sit to get into the USA medical careers system, and how different those exams are, and why it was a challenge for her as a woman to access it in USA, and how the UK is easier. What about UAE, Dr. Bashira, before we move on to another question?
So, but you know, UAE is quite different because in terms, for me, I really don't know how like a budding physician is going to get in here. But the UAE, for someone who is fully trained in the US and the UK, they usually like to have you as a lead doctor, so like a consultant, stuff like that. So it's so easy if you're already at the height of your career, like in terms of you're already like a senior doctor. But for a junior doctor, it's going to be hard. Even I'm talking about senior doctors. Even, for example, if a doctor who trained in Nigeria wants to come here, they have different levels. The doctor, a consultant in Nigeria, would not be able to become a consultant here because yes, unfortunately, they don't accept. It might be like a specialist. You have to do like a registrar, like a senior registrar under consultant. But they do Nigeria. They tier the levels of qualification. So UK and US are like tier 1, and Nigeria is not even tier 2. I don't know, maybe tier 3 or something like that. They have a way they categorize the qualifications. Unfortunately, again, this is the challenges we face in Nigeria, because South Africa, I think, is way higher. I think if it's not tier 1, it's tier 2. So those are the things that our government needs to get some qualifications that is recognized. Because even in the UK, like the MRCOG I said I got, I think they've even retrieved that now. You can't get that equivalent anymore. I think a year or 2 after I got that, for the MRCOG. Again, just because of the standards going down in Nigeria and stuff like that. So again, that's something that hopefully the government can work on.
Oh, okay. So those terminologies that you have used, residency, house, job. So talk to me about. I really know you've spoken, and I'm just I'm boss ready. I want to become a medic. Talk to me. How do I go about this?
Okay, so first you have to go to med school, right? So med school, it's different. It's similar in Nigeria and the UK. As I said earlier, the UK and Nigerian system is similar. So you can really get into med school based on like after your GCE and JAMB. I think that's what we still use in Nigeria. Or you could do A-levels and then get in from the second year. So med school in Nigeria and the UK is 6 years. Okay, so if you're going through A-levels, then it should be 5 years for you. And then you go through everything. But in the US, it's quite different. And also in Nigeria and the UK, if you want to study medicine, you have to be science-based. You go study history in your high school, be in the history class or the art class, and then you want to apply to medicine. It doesn't work. You have to study chemistry, biology, physics, and stuff like that. But in the US, it's quite different. It's different because they first get whatever degree they want. And trust me, very interesting degrees like art, any degree they want, they get so they first do that first degree, the 4-year degree. Then they go and do like a pre-med. I think it's 1 year or 2 years. Then they go and they start medicine. So it's like 4 years, 8 years for them in the US, or even longer, to become a physician, because they have to get their first degree. Almost everybody has a BSc or BA before they go into medicine. There's nothing like you're finishing secondary school or high school and then going to medicine, or finishing A levels or going to medicine. You have to have a degree before you study medicine in the US. So that's how it's different. Now, once you become a doctor, then the next step is training. So again, training is so different in these two systems. Like Nigeria and the UK again are similar. So you have the internship. Totally. So usually in Nigeria, you apply for the internships totally separately from residency. It's not connected. But the US is quite different. And I'll first speak to the Nigerian system. So you apply for internship, which is 12 months, so a year. So, and it's standardized. You will spend 3 months in medicine, 3 months in surgery, 3 months in OBGYN, and 3 months in pediatrics. So it kind of gives you like an all-around knowledge. Then after that, that's when in Nigeria you would go for national service. Then after your national service, you begin to apply for residency, or you start working as a general practitioner until you decide when you want to apply. In the UK, it used to be 1 year, but some years ago they said this foundation year. The foundation year was also including the internship and another extra year, so like 2 years, but still similar. And then after that, you apply for residency. But in the US, the internship is merged into residency. It's quite interesting. So it's merged into residency, and usually, but very few cases where you can do it in, they call it, they don't call it, there's a name they call it, but you can do a year before. For example, if you want to do competitive specialties like radiology, maybe you do 1 year of that internship, and that internship will be in internal medicine, and then from year 2 you go into radiology. And then depending on what specialty you want to go into, the duration will vary. So for example, if you wanted to do any internal medicine specialties, you would first have to become an internist. So you first have to do a residency training in internal medicine. So that's 3 years, including the internship. Then if you want to subspecializing means in internal medicine, which is just your main practice of the general medicine. There are multiple subspecialties. So you have endocrinology, gastroenterology, neurology, pulmonology. So the lung specialist, the heart specialist, the gut specialist, the brain specialist, the skin specialist, all the specialists they're under that. Then you have to go and do maybe 2 more years. After that, even some another 3 years, some another 4 years. So depending on what specialty you want to go into. And then of course we have the surgical specialties. Surgery tends to take longer. It just tends to take longer. In the US, surgical specialties are more competitive. And it's not like the UK. That's also the difference. In the US, in the UK and Nigeria, doctors are paid based on their level. Like consultants, you get about the same pay. In America, it's based on your specialty. So yeah, there are doctors in the US that will get paid 3 times what I earn, just because of what specialty. So like orthopedic surgeons get paid a lot, straight out of training. They will be getting paid maybe 3 times or 4 times my salary. So that unfortunately, that's what ends up driving what specialties medical students go to. So specialties like mine, infectious disease, don't have so many of the medical students coming there because unfortunately it's very expensive to go to med school in the US, and so they want to be able to pay their debt, and most of them are in debt. Alhamdulillah for going to med school in Nigeria, but a lot of the doctors are in debt for years and years. So that's
I'm happy you mentioned that brain drain advantage or disadvantage to Nigeria, because Nigeria trains medics and then
for other countries
to use them and valued.
Assalamu alaikum. Sorry, can I chip in and say that that's a very good plus for Nigeria there, because a lot of students, they normally say Nigeria, our education system is a bit somehow, but then we've got lots of doctors, and a lot of people normally testify that the payment is quite subsidized here in Nigerian universities. And based on what you just said now, it's so obvious. So we don't want the government to increase it anyway, so that it's easier for any poor man or poor people to go, because a lot of people are already in debt. So please continue the conversation. I just wanted to change that. We appreciate Nigeria for that.
We appreciate, trust me, I do. But what's the point training doctors that you cannot keep?
Sorry?
What's the point training doctors you cannot keep? Because ultimately, it appears that Nigeria is training doctors for other countries. It's sad. I never wanted to leave Nigeria. But even when I was living in America, I was looking, my goal was never to go to another country. My goal was to go back home. But where are the opportunities for me? People say, oh, you have to go and set up your own clinic. I say, is it all those big clinics that charge crazy money where the poor people cannot attend? So what's the point? So because I've worked in those clinics, I don't know Lagos so much, but I've worked in Abuja, I've worked in the expensive clinics in at least while I was in Nigeria. There was, and they charge a lot. I mean, it's not for the poor. I saw people like late Stella Obachiso in that place. All the ministers attended that clinic.
Can I chip in here? What I would just say is this. Okay, Nigeria has given the doctors as help to subsidize their fees. So a lot of people did not go into debt and be paying later. What I've realized with other tribe, let's say I've got some friends that they are northerners. Some of them, after they finish maybe here or abroad, they try to come back to Nigeria, start something, and you see poor people were able to manage. But here in the southwest, it's a different ballgame. Even for you to even go to those kind of clinic that they have, just like what you said, that what is the point? What I would say is that, alhamdulillah, Nigeria has done their best. Everyone should have something, one way or the other, to just say, okay, let us to contribute in our own little way. Because, like you said, Nigeria is draining them. We are draining. We hope we are not having the brain drain in Nigeria at the moment, because a lot of our professionals are going abroad. A lot of professionals are going abroad, and they're doing quite well abroad.
But Sister Wasila, let me explain to you. Do you know how frustrating it is for people to get into a house job in Nigeria? Can you imagine finishing studying medicine? I know people who stayed home 2 years trying to get a house job position in Nigeria, just because the medical, there is no opportunities in the hospitals. We're training too many doctors, and we're not planning about how to absorb them. There are people who go into depression trying to get jobs as physicians in Nigeria. Or you have to settle in one place and be super underpaid, be abused. So trust me, a lot of people living in Nigeria don't want to leave. Want to leave. But there's no opportunities. And then in adding to that, I come from a family of physicians. Okay, my great grand uncle is a cardiothoracic surgeon. And imagine he trained as a cardiothoracic surgeon in the US, and he was willing. I'm talking about my grandfather's brother. He was ready to come back to Nigeria. Do you know how they frustrated his life? He came back and wanted to because there was no cardiothoracic surgeon, maybe one or two in Nigeria. He wanted to come back and give back to Nigeria. He was who is who in cardiothoracic surgery in the US. Packed his bags, came to Nigeria. He ended up having to go back to America, because it's like, oh my God, he becomes a threat. Because the problem, unfortunately, this is Nigeria. They want to see you coming from abroad. I know too many people who try to go back home, and then they're like, oh, he wants to tell us what to do because he studied in America or something, and they frustrate their life, like you're there to take their position, and they leave. And
yes, the sky is big enough for all of us to fly in. Unfortunately, that is something that is missing. Many people are at a loss of that knowledge. There is something good, though, that is echoed everywhere. about Nigerian doctors, and that is how caring and how amazingly well-behaved Nigerian doctors are. So I want to ask you, our culture of which is we're expected to be obliging and polite, which is amazing that we are known for that, especially as very caring medics, whether doctors, nurses as well. But do people misunderstand that for cowardice or a feeling of inadequacy? Did you experience that in any of the places you worked?
No, you see, you have to adapt. Yes, when I first started, that was challenging. There were lots of tears, trust me.
Brilliant tears.
Yes.
Brilliant tears.
Yeah, there was lots of tears because, I mean, you see somebody just try to put you down and step all over you like this, and you'll be like, what the heck is going on here? Even somebody who's like, besides the age, you know, you're like, too many things. You're like, what the heck is going on? Is it because I'm starting over? And, you know, so, but when you know, I would say maybe when you're in Rome, there's the Romans, or you just have to grow up and wake up and smell the coffee. Otherwise, they will step all over you. That's for sure. You will be stepped all over. And I got a bit of stepping all over before I woke up. I said, nobody can step all over me. You know, like, you know. So in terms of like maybe even duties, like once they see you don't talk, you know, when they start to distribute the duties, you're on the same level. Before you know, you're on the same level. But if you don't open your mouth and speak for yourself, trust me, you will get the worst cases, the most difficult stuff, and they'll make you look like you're just not hardworking. Meanwhile, they took all the easy stuff and left you with the difficult stuff, you know. So you have to learn to speak up for yourself. I actually started learning that quickly because when I got to the US, there's something when you're applying for residency programs, you have to write a personal statement. And you know, in Nigeria, it's not. As you said, our culture, you don't sell yourself. You don't go say, oh, how smart I am and how this. You don't do that. But in America, if you don't know how to write raving reviews about yourself, sorry, your letter is going to be put aside. You might not even be shortlisted for the interview. You need to actually attend. So I had to literally go to people and say, help me write. I don't know how to write the letter because I was like, oh my God, I never ever, all I had to do was present my qualifications. But in America, that is not enough, presenting your qualifications. Everybody has that.
Wow.
What's unique about you? They want you to say, what's unique about you? What's so special about you? What's special thing you've done? I was like, oh! You know, it was a shocker for me, and I had to seek help from friends who had been there for years to help me write my letter to get it.
Okay. Thank you for that. Before I ask you about what specialties, because we've touched on specialties, but it's always good to give a sort of broad overview of what specialties are. So general medicine, surgery, ONG, public health, and then which subset specialties do you think are easier for women to get into? So maybe like some affirmative initiatives around those specialties or funding opportunities. But before I come to that, let me quickly ask Sister Amina if she has any particular question for you.
No, I'm just enjoying the ride. This is interesting. You're just making me feel like, should I go and do medicine? Actually, now that she said in US, for example, I can just do Yoruba horticulture and come and enter medicine. So maybe I should be dusting my bags and heading to the US to learn to be a medic.
Don't worry, you can come to the UK. They started their entry medicine here.
Thank you. I'll pass. I'll pass. Let me go to the US of and then 4 years after I'll go and do cardiothoracic or something and be learning big money. It's all about
Sister Wasila.
Yeah.
Inshallah. Sister Wasila, do you have any question?
Not at the moment. I'm enjoying the conversation.
Exactly.
If I have anything, I'll just chip in. Sure.
All right, inshallah. Okay, so Dr. Bashir, to the question about specialties, just give us a broad overview of this, like the main specialties, and then tell us which subspecialties would you recommend for a woman, apart from the very expensive, the ones that are high earners. Sorry, those ones first. Mention those ones first, please, so that I can take notes of them.
You said, waiting for.
And then others.
Get into, by the way, they're very, very, very competitive. You have to have a very competitive edge to get into those. They're like cutthroat, because they have so many people applying to them. But yeah, So first we have a broad overview: medicine, surgery, obstetrics and gynecology. and then family medicine, pediatrics, right? So in medicine, I said like we have like so if we start from the head, neurology, so study of the brain, ophthalmology is also a field on its own. For some reason, it stands out. It's not really under surgery or medicine in the US anyway. In the UK, maybe it might be under surgery, but ophthalmology is on its own. ENT is a surgical specialty. Dermatology is a medical specialty. In the US, it tends to stand on its own too. It's interesting how they make them, but usually in other countries, dermatology is under internal medicine specialty. Neurology in the US stands on its own. In the UK and every other country, even in the UAE, it's under internal medicine. Okay, then you have cardiology. So cardiology is like the science of the heart. So that's under internal medicine, but the cardiothoracic surgery part is under surgery, of course. Then you have pulmonology, so that's the study of the lungs, and that's under internal medicine. And then you have the guts and gastroenterology. Okay, then dermatology is a higher paying specialty because now everybody is all about how they look, looking younger and everything. So now all this Botox business. So it is now a higher paying specialty, but still the surgical specialties are paid more. In terms of internal medicine, dermatology is paid higher. Cardiology, it depends on what kind of cardiology, because even the cardiology now, there's sub-specialization in cardiology. There is interventional cardiology, there's electrophysiology, and then general cardiology. General cardiology now doesn't get paid much. Like interventional cardiology, bottom line is that in the US, it's all about procedures. If you do procedures, you get paid a lot. Okay, so interventional cardiology, they do procedures. They're the ones that do for MI. If you have an STEMI, they unclog the arteries and stuff. So they do procedures, so they get paid much more. Electrophysiology is the same thing, like people who have irregular heartbeat, like atrial fibrillation, like the irregular heartbeat. So they stop it, they go and burn or whatever the side the problem is. So again, procedures, they get paid more. Okay. Then general surgery, you have general surgery, just the general surgery, then you have the orthopedic surgery, neurosurgery, thoracic surgery, plastic surgery. Plastic surgery does get paid a lot more, and orthopedic surgery, because a lot of people are having knee replacements and all these joint stuff, so they get paid more. Also vascular surgery. So you have vascular surgery too. Then in obstetrics and gynecology, they also have subspecialties like fetal maternal medicine, like but not as many. Oh, and like the ones that do the IVF, I forget what they call them. But they do have those subspecialties. Then you have pediatrics. Pediatrics, you have general pediatrics. So they're the ones that just see the patients in clinic, but also pediatrics has a specialties for everything. Oh, I forgot to mention endocrinology. Is for hormones and stuff. Yeah. So the glands and stuff. So you have all of that. Whatever you have in internal medicine, you have in pediatric subspecialty. And pediatric endocrinologist, pediatric oncologist, and that stratifies it. When we were talking about medicine, we have to remember what we're talking about is orthodox medicine, right? So this is more medicine, because we do have alternative, complementary, holistic medicine, which we will not be talking about today because I do not specialize in that. And we do have people who are now combining both worlds, orthodox and alternative medicine, and they call it integrative medicine. But that will be a more comprehensive conversation, not for today. Just so we are aware that we're talking about orthodox medicine here.
Right. Madam, are you still there?
I'm saying, so ophthalmology, can you hear me?
Yes,
I can hear you.
Okay, so ophthalmology is both surgical and diagnostic, isn't it?
Yes.
So that will get me a lot of money as well.
Oh yeah, ophthalmology is very well paid. Yes.
Okay.
Because it's a surgical specialty. Yeah.
So because anything that is surgical, like you mentioned, the training is
only as well. In the US, not in the UK. UK is totally different. UK, whatever you specialize doesn't really determine how you're paid. You're paid on your level.
Yes, I got that. So now to the question of please, now, out of these well-paid ones, which ones are good for women? Let's start from there.
Okay, so I would say the one that has a 9 to 5 job. For example, looking at me, when I was moving to the US, I did consider going to continue my obstetrics and gynecology, but there are a couple of things that took me back. First and foremost, I chose obstetrics and gynecology because as I said, I was born and bred in Maiduguri, where women don't like to go to the hospital, and where there are very few female physicians. So if there are few, definitely they are not in ONG, which is a very busy specialty. And it's also a surgical specialty because you have to know how to do a cesarean section, you have to know how to do ovarian cystectomies and stuff. So it does turn out to be a busy specialty. So even if a few women that study medicine that I knew back then, they didn't want to do ONG because there's no way you have time for a family. But I was young and I was like, I'll be done my training and all of that in no time, until I was hit in the face with the difficulties of the opportunities in Nigeria. But by the time I was going to the US, what held me back from doing ONG? One, they have high litigation rates. That's another thing you have to know about the US. The litigation, if you have any more money, just know that you'll be faced with likely more litigation. Okay? So they have very high litigation rates. Somebody can come and blame you for how their child is behaving when they're 18. That is how you deliver the baby.
Oh my world.
So when I heard that, I was like, are you serious? After all these years going around, now go and somebody's going to take away my career because one court decided to give them all my life's worth to be paying.
But how much do you pay in insurance to prevent you losing?
You do pay. Actually, your workplace will pay. But at the end of the day, because of how much litigation they get, their insurance is very high. So the salary that's supposed to be high is not high anymore. So why should they be worth it? You see them, they look so worried. There's so many cases of people leaving after so many years of practicing OBGYN and going to start residency all over again to do another specialty. So when I visited, as a sidetrack, and when I visited Turkey, coincidentally we traveled with this family where the grandfather, it was a family, 3 generations traveling together. So the grandfather was a retired neurologist. And when I told him that I had started out as OBGYN and I switched to infectious disease, later, it was my husband that told him, and later I pulled me to the side and said, I just wanted to tell you, you made a great decision to have done that. He told me he had a family friend where both husband and wife were doctors, and the wife was a obstetrician gynecologist, and then she had to they were in a small city, and then there was this complicated cesarean birth. And I think it was a vaginal, but it was a twin. So one of the twins got stuck, So eventually, I think maybe there was some complication, and they sued this woman. The money they were asking for, she will never be able to pay the money. So literally, if she continues to work, all her salary will be going to pay. So she decided to retire. She said, no, it's not her fault. Like, to err is human. They want to blame her for the resources. It was multifactorial, the error. So they blamed her for it. And so she decided to quit because she said, at the end of the day, what's the point working? All the money till she finishes practicing her medicine will be going to that family. The money that they say she. So because if she can't pay it, there's nothing they can do to her. And they can't take it from her husband. So she decided to go. So she couldn't practice medicine anymore. She said she'd rather not practice medicine than to continue to practice and then be giving all her money to something that wasn't completely her fault. So these are kind of the challenges. So I would say specialties were 9 to 5. Okay. That's one of the reasons why I took infectious disease, because infectious disease, you don't really need to be on call in the hospital. There are other junior doctors, like you have other doctors that they're the general doctors. They can wait for you in the morning. They can speak to you over the phone. You don't have to be there. So dermatology is one of the specialties women love to go to because you don't really, very rarely, dermatological emergency, very rarely.
Now you are talking that one. There's money and there's night in hand. That's the one we should be hearing.
Yeah. So ophthalmology too. I think it's one of the specialties that women do go to because most of the times they do their surgeries in the daytime. Rarely, again, do you have overnight, and you will have one shift. It's not one of those very crazy, busy specialties. Then pediatrics. A lot of women go into pediatrics. Family medicine. because again, all of this pediatrics, if you just general pediatrician, is 9 to 5, so you just see in the office. Family medicine also 9 to 5, you just see patients in the office. So
family medicine, if I can just say, is same thing as GP in the UK. Exactly. And your family doctor in Nigeria.
Yes.
So if I may jump in quickly, I
have training in America. It's not like Nigeria that they do have training in Nigeria too, but a lot of people practicing GP in Nigeria are not trained. They're just like after school, just general, but they do have GP training in Nigeria as well.
Okay. Please jump in, Sister Amina.
Right. So I find it ironical that, incidentally, as Muslim women, we crave for female gynae, right? We want the OBGYN to attend to us to be female. Here we are saying women don't come to OBGYN on your own. No, it's
I didn't say that.
No, don't mind. I'm just in hindsight, like
I do say. By the way, in the US, there are so many female OBGYN.
Okay.
Even me, or my practice purely female. I made sure I looked for a practice. All my kids born purely female, they know. Even just in case, like the practice might be working in a hospital where there are men, I said, make sure that they know that is not an option. So my doctor will be sure to be there, because they have a whole practice. So many practices women in the US, which is good. And I would love for something like that to be in Nigeria, because in Nigeria, the issue is vesicovaginal fistula. I don't know if you've heard of that.
Yes, that thing was very popular.
In Borno, it's so bad. It's so bad. And they will have the babies at home. I know so many women next door to us. The next day, you just see, what happened to your belly? You already had a baby. Yes, in the toilet. I was like, what? In the toilet. And how did you cut the umbilical cord? With a razor blade. So how is this child going to, when you ask her, she's had 12 kids and maybe 6 survived. So that's why Nigeria high fetal maternal mortality rate, and I was very passionate about that. And even that also contributed to me wanting to do public health, because the problem is even a public health problem and related to OBGYN. It contributed to it.
Yes, we will have to have you back again, Dr. Bashira. You need to give me another date, because I still have loads of questions for you, but we're almost out of time, and I need to ask you one last question. If you can't go into medicine, what other career would you have done? Even now, like if despite all your, if you have to
go or English literature. I loved literature. The interesting thing was in my school. I wasn't allowed to study literature initially, because they said the science student was a science student doing literature for. For some reason, I hated geography. And I was like, no. So I bought out the book, the WAEC book. Back then we called it WAEC, right? So I bought out the WAEC book and said, WAEC says 1 of geography, history, and literature. They said, but you're in a science class. It's not even on your timetable. I said, I'll make it work. And I did make it work. Alhamdulillah. So I did love literature. I love to read. Now I'm trying to boost up my reading skill, my diverse reading skills again, because I kind of lost it over the years just because of the intensity of training, having kids and all of that. But now I'm trying to kind of bring it up again, inshallah.
So maybe, that's amazing. And in fact, one of the things about medics, in the UK, is they often ask that they should be reflective and they should journal, because it does help them with actually coping with all the stress of, and so that sort of field is very, very is highly, that's the skills that you gain from English literature is highly encouraged and very useful for medics. So if just to go over what we've said to our viewers today, Dr. Bashira Giwa has done an amazing job. I hope you agree with me with schooling us very, very briefly. I'm sure if we had more time, we'll be able to.
Just like you said, we're going to have to have a back. We're going to have to have a part 2, part 3, part whatever, until we exhaust all.
Inshallah. So PLAB is the way to UK. USMLE is the way to the USA. But like she said, we need lots of doctors in Nigeria, and we need our governments to please make sure that our doctors, especially those who want to stay, can stay. Yeah, I think that is the key thing that I will take from this. On that note, Jazakumullah khairan to all our listeners. Please like, subscribe, and comment on our Instagram, which is lights_radio, and our Facebook, the Lights Radio. And inshallah, until next week, from me it is Assalamu alaikum wa rahmatullahi wa barakatuh. Sister Amina Stawasila, would you like to give your final comments?
Oh, that's it. We'll see you next week. Bismillah. Assalamu alaikum.
Alaykum salam. Next week, inshallah.
No.
Dr. Bashira?
Thank you. Thank you for having me.
It was an utmost pleasure. Alhamdulillah.
You're welcome. Thank you for coming. Wa alaikum assalam.
All right then. Bye, Bebo.
Thank you. Thank you for having me.
It was an